Just stepped on some dude in traffic.
Oh, okay, so it was so you just caught the. It wasn't like you rolled it for no reason.
I didn't roll it for no reason. I caught somebody.
You caught a foot and went over, and you felt like a crack palm snap.
This flailer.
A flailer.
A flailer.
Don't you hate that?
Got me.
Switch back.
Trying to control his own body.
Right.
Wound up.
This was last night.
This was last night. Yeah. Okay.
So welcome back to another session sit-in. I know it's been a while, but we've got a nice, acute ankle that we're going to work with today. This is Tom. Say hi, Tom.
Hey, what's up, everybody?
So unfortunately, Tom's in. If you want to come around this side, you can take a look. And just what we're going to look at real quick from like an ankle perspective, we can see a lot of local swelling, kind of right at like this sinus tarsi, which is kind of that little notch that we get right here in the ankle. Is that super tender in there?
It's not actually.
It's not. How about like up here more? More tender here?
More tender there.
Right,
yes,
so now I'm kind of palpating through these tib-fib ligaments, right? So you can see how this swelling's kind of like sinus tarsi and a little higher. So this may be a syndesmotic sprain or a higher ankle sprain, which is the difference between basically the fib and the tib kind of getting splayed apart. Now this is an ankle that he sprained previously, right? You've sprained both ankles, so
many times.
Especially in basketball where we get some contact in there. So what you're going to see today is we're just going to treat this acutely. This is a day old, and some of the techniques that we can use to mitigate some of this pain and swelling and just augment his body's natural healing process. But a couple of things that I like to do to evaluate this first is we want to rule out fracture. And the first way we can do that is just by observing it. There's no gross amount of swelling here. I mean, there obviously is a local swelling, but if this was fractured, we'd see really dark bruising, lots of pooling of blood down in this area because the bone will bleed. But one of the things we can do is just a bump test, firmly kind of smack here. How's that feel?
Feels okay.
Feels okay?
Yeah.
So that's going to rule out a fracture potentially, and we can confirm that with a long bone compression test. So just kind of compressing the tib and fib together towards the top. How's that feel?
Yeah.
And if you get pain down here, that can be an indicator that you might be dealing with a fracture, and that should be something that we refer.
Yeah, thankfully, not a lot.
Nothing there, right? So then we can go to our ligamentous test, right? We want to check this ATFL ligament, so the anterior talofibular ligament. We could just do a simple like anterior drawer. So if he relaxes this ankle, and I just try to glide that talus anteriorly, and he does have some laxity here, but that's likely due from a previous sprain that he suffered. And the last one we're going to do is a Klieger's test, which is just bringing this ankle up into dorsiflexion, kind of using his talus as a wedge by internally and externally rotating his ankle in this closed pad position. You feel a little bit there?
Okay, man.
You're okay? How about if I really give it a little extra?
No.
No, how about this way?
I probably have nothing left in there.
You've done some stuff to this thing over the years. But so, my assessment for this ankle, again, just quickly looking at it, knowing Tom's history of previous ATFL sprains, just by location of this swelling, again, this is a day old, where he's tenderest to palpation is right over those inferior tib-fib ligaments, okay? So typically this is something that may take, how does it feel walking around? Is it painful every step, or?
You know what? I'm so used to this kind of injury that it doesn't feel good. It feels achy to be on my feet.
Right.
It also feels achy
sharp,
if it's not sharp. It
Okay.
also feels achy if they hang in position. The most comfortable is as we are now,
Right.
supported, laying
Right.
down.
So one of the other things I want to assess really quickly is just what his active range is right now. So again, we'll do both ankles at the same time. Just pull them both up towards you. Right. Good. So they're about equal there. Go ahead and press on the gas now. Right. Again, full range in a plantar flexion. Let's go into eversion, so out to the sides. Feel any issue there?
Not too much.
Now go inversion, so you point and toes in.
Yeah,
So obviously this is limited here. This is the mechanism of injury. So we're not going to crank and load this position, but this kind of seems to me like a little bit of a higher ankle sprain. So now we're going to work on.
Up my feet a little better for the intimate.
Oh, that's okay. Dude, they're beautiful, man. These are beautiful.
I would have done a little maintenance.
It's all good. Well, there are some creepers on my YouTube channel, dude.
I mean, this was.
I'm sure there'll be some comments. Like if I make like a.
This was a real visit, man. You know what I mean?
Let's do this, Tom. I'm gonna have you spin around. Put your legs on this side, because I'm gonna use the table so that we can elevate your legs. So we'll get rid of this. So that's that again.
Yeah, I did ice last night, just.
Which is fine.
Yeah, I
the
have
first
like a foot
24
bucket,
hours.
Dump ice in there. And
Yeah, a little ice bucket.
Five.
So that's a good one. Little cryokinetics and get that thing moving in there.
Yeah.
So that's one of the things that's pretty, like in the first 24 to 36 hours, totally fine to use ice. I'm not an anti-ice guy, but to bury this thing in ice consistently is going to slow stuff down. Okay, but the first 24 hours, 36 hours, definitely not a bad idea because that cold temperature allows the cells that are not injured to survive that low oxygen environment. So definitely icing 24 hours post-acute injury is a good call. If you're in pain, I like ice for treating pain because it's not drugs. You know what I mean? So if you're in pain, it's a little sore, and you want to do some contrasting there, that's totally fine too. So we're just gonna, so what I'm working on now is just some lymphatic drainage stuff. So we're gonna just kind of work nice and kind of shallow strokes. This is really light pressure. I'm not pushing tremendously hard because this is going to be acting on some lymphatic system, which is really superficial. You don't need a lot of pressure for this. So I'm basically just creating small circles and kind of changing some of these pressure gradients. You know, some people will call this like a milk massage. So I can even kind of use my hand to contour that and start to move some of this fluid out. Now again, the swelling isn't a bad thing. It's a natural protective mechanism, but we want to kind of aid as best we can in getting rid of this stuff. So the plan today is going to be to do some lymphatic drainage stuff, maybe some positional isometrics, just to, again, to begin the process of helping his body remodel this tissue by introducing load. Right? So load is the only way for your cells to remodel and adapt. So we're going to slowly start to introduce some micro load to this while he's, you know, in this rehab process. So now I'm starting to work a little bit more like a squeegee, using my thumb and forefinger like a squeegee. You know, again, the goal being, can we try to create some of this lymphatic and venous return? Okay, so the way I can augment this really quickly is actually to utilize my little Compex unit here. So Compex is an over-the-counter e-stim device. And this is something that I really like to pair with some of my manual treatments, especially when we're dealing with swelling, because now I can use a muscle pumping action to my advantage as well. Okay, and again, you don't have to agonize over your pad placement. What I'm going for is gastroc complex and a little bit of this fibularis complex. My goal will be to use the active recovery setting on this Compex unit to kind of create an external pump. So meaning like his nervous system's not going to have to produce the energy. I can produce the energy with the stim unit. I really like this Compex. This is the wireless sports elite model. The advantage to this is these wireless pods that you can use to create the stim. And then I can use the controller from here. So basically we're just gonna turn that bad boy on. So I'm gonna go to I'm gonna use a recovery setting, okay? And the reason I wanna do a recovery setting is because that's going to give me that fast twitch response that I'm looking for. So again, giving his body the energy externally, right? So now we're going to select that, and I'm just going to up these so that I actually visibly witness like a fast twitch response here. So you can see already how we're picking up a little bit of ankle movement. How's that, Tom? Is that too much, or is that okay?
Good.
You're good?
Yeah.
Go a little more? So basically what we're creating here is an external pump in terms of, or an internal pump using his musculature, which is what his body would naturally do. So your lymphatic system doesn't have a heart. It relies on your muscle action, essentially as a way to create that reverse pressure and return this lymph to your core. So what we can do is provide you the energy while you're recovering using something like this. And this will actually help drain some of, now we've got this internal pump using the stim going to, working in my advantage. I got gravity working in my advantage. Now I create an external pump using my hands in this lymphatic drainage, right? So we got kind of a three-fer happening all at once here. Again, the goal being to just influence that fluid flow back towards his heart. How's that pressure, okay?
It's okay.
Let me know if it's too much. Good, buddy?
Yep.
This is a good example of how we might layer a treatment session, when we're dealing with something more acute like this. Again, I'm still in that really mild to moderate pressure range here. Nice, dude. Starting to see bone. Starting to see bone here. No, so if you have a Compex unit at home, like a stim unit that can create a TENS unit, you can use really any TENS unit for this to create this kind of muscle action. But what you're going to do at home, Tom, is just get this elevated at night and just kind of pump this ankle straight up and down. Right. So as long as we work this ankle in sagittal plane, we're not going to stress these tib fib ligaments, and just introducing some movement, open chain movement, non-weight bearing is totally safe. You know, you work on some ankle cars as long as they're comfortable, right? So some controlled articular rotations, just working this ankle in a big circle, right? But mostly,
flexion is totally cool.
This is totally cool. So we're going to pump this up and down, so that's basically what we're working on. Okay, so this is obviously going to be fatiguing, whereas what we're doing here is kind of non-fatiguing, because this is providing you the energy versus internal. But again, move it. The worst thing you can do for one of these ankle sprains is really, unless it's a fracture or like really unstable where you're at risk of hurting it worse, throwing this thing in a boot is just going to make this problem worse, because you're not going to allow that swelling to resolve. You're basically just taking away the mechanism or the vehicle that your body would naturally use to return that swelling. So I like to be aggressive with these and introduce more movement earlier in the process, reduce the use of ice earlier in the process, reduce the use of NSAIDs earlier in the process, which brings us to like the nutrition convo, which is I know you're good with, but in this stage of healing, things like segmented berries, raspberries, blackberries, blueberries, these kinds of things are really great. High in antioxidants. Pineapple, high in bromelain, which is a really good natural anti-inflammatory. Turmeric, and throw some more turmeric in your food, or curcumin. Right, you know, fish oil, healthy fats, olive oil, fish oil, avocados, like all of those healthy fats are also really great for the inflammatory response. So we can attack this holistically or nutritionally from a systemic level, as well as, you know, attacking this from a local tissue level. You can come to this side now and see how much this swelling's already kind of reduced in just 10 minutes of doing this. All right, we're actually able to see, and I can actually feel and touch his lateral malleolus now, so that's a good sign. So the next step, and I'm just going to leave this stim on here while we do this, is going to be do a little bit of instrument work. Now, I'm not going to go super deep with this. The goal is going to be just to feather. Right, so feathering is a really light stroke. This is really more for pain modulation. I'm
so bullish on that, man.
What's that?
I don't know, those tools I love.
Yeah.
I just do.
Right, so again, we could use this as a squeegee if I wanted to kind of help squeegee this out by using a hard edge. Another tactic we could do is definitely throw this in the freezer, or I could even throw a little bit of this rock sauce ice, which is a menthol analgesic. So this is another way we can reduce pain. I can use this as a little bit of emollient, right? So this is kind of like your icy hot biofreeze kind of thing, right? So this is, I can go a little bit of light feathering. Again, the idea here is force is the language of our cells. If you guys follow FRC, they're really famous for kind of making that quote, which I really love. But the reality is your cells are only going to respond to mechanical pressure. So just by giving this a little bit of mechanical pressure, we're stimulating fibroblastic repair, which are the little cells within our body that produce connective tissue, right? So they actually create the own environment. So they produce collagen, they produce, elastin, all these different types of fibers that we want to see. So I can actually be force or directionally specific and just kind of stimulate his body to laying down more connective tissue, right? So the other nice thing about this is we're going to get some pain modulation from this, right? So again, this is a sensory thing. So I'm stimulating the parts of his brain right now that govern the lateral part of his ankle, and we can actually create a little bit of pain relief manually this way too. It's transient, it's temporary, but any pain relief is going to be temporary. So I'm just kind of, again, maybe in that 1 to 3 out of 10 on the pressure. How's that, Tom? Is that bothering you?
No, we're good.
Feels good, right? It's kind of like scratching an itch.
Yeah.
And you can see how I'm really focused around this, like imagining where his tib and fib would be. So fibula, tibia, the ligaments that hold these together. I think that's kind of where his injury may be. So with a higher ankle sprain, Tom, we're going to have to be a little bit more conservative with this. Whereas in the past we really pushed like weight-bearing stuff quickly. Not to say that you can't weight bear. I think walking will be fine for you, as long as it's not getting worse. If it starts to feel like the pain's getting worse, we may have to kind of take you off your feet for a couple of days, let that heal up. But I don't think this is bad. I would call this like a grade 1 plus. I think, you know, it's a tweak.
Yeah.
But,
Yeah.
you know, let's just track it over the next couple of days.
Yeah.
So today's day after, right? So
Day
day 1.
Yeah.
Day 2. By day 3, you should start noticing that after day 3, it gets a little bit better each day.
Okay.
It might feel about the same tomorrow, or maybe even a little worse tomorrow.
Yeah.
But by day 3, you'll get over that hump, and it should 4, 5, 6 should be a little bit better each day. As long as that trend is the same, you know, obviously we're gonna have to hold on basketball for a while, but we could just modify your training to kind of work around this ankle in the meantime.
Okay.
You know what I mean?
And like, when would you want to see me again?
I would like to see you maybe get another session with Anthony at the end of the week. I'm going to be gone on Friday, so maybe come in on Friday and have Anthony kind of repeat this.
Right.
If the swelling is really resolved, then we can wait. If the swelling looks really good, like it's gone down quite a bit, then we can wait till next week.
Okay.
But we'll give you, you know, so you can work on some of those positional isometrics that Anthony was having you work on, right? You can still do that. Just don't be as aggressive on the range.
Yeah.
Yeah,
Also,
they're
like,
popping off a little bit.
what do you think about, so lifting today is probably out, you would
I wouldn't say it's out. Let's do an upper body lift today. Let's get your heart rate up. That's a great point, actually, is the automatic indication when you have an acute injury is to not do anything. The best thing we could do right now is get your heart rate up. Get your blood flowing, man. So get on that assault bike, non-weight bearing. There's nothing, and that's going to bring you through some range of motion.
Non-weight bearing, sagittal plane.
Sagittal plane, yep. So we're going to get that ankle moving in that dorsiflexion, plantar flexion, range of motion. You're going to get the whole body moving, get your heart rate up. You know, get a little cardio session. That's going to help that healing process. You have to pump that fresh blood down here.
Right.
You know what I mean?
Right.
So, you know, again, the automatic thing is rest. But guess what? Rest fucking fixes nothing. You know, you're not going to automatically heal and be good to go just from resting it for a couple of days, right? So, you know, I tend to be a little bit more aggressive because understanding that the only way your tissues are going to adapt is to load them. And again, we just have to be smart. We can't, you know, you're not going to go and do box jumps today.
No.
You know what I mean? Or anything dynamic, but to say that you couldn't, you know, do some light, you know, do some cardio work or maybe some upper body lifting today.
Sure.
And then maybe on, Thursday, Friday, when we come back, we can revisit and maybe do a light lower body lift.
Yep.
You know, where it's just
Yep.
body weight stuff.
Yep.
Again, putting some weight on that ankle. So this one fell off. I'm just going to pull it off now. You know, getting some weight on that ankle and start moving through some ranges of motion. There's nothing wrong with that.
Okay.
Okay, we just got to listen to your body.
Yep.
If something is, if it barks at you, we're not ready yet. We're going to stay away from frontal plane, right? So side to side movements and
Yep.
rotational movements for now. Just stick to sagittal plane stuff.
Yep.
That's going to be like the next few days.
Okay.
Okay, but definitely get in there. I'll talk to Warren and we'll modify your lifts just so that you can do something.
Yep.
And maybe it's a shorter lift, 30 minutes, upper body only.
Yeah.
A
Just
lot
get
of
the
bench
heart rate
stuff,
going.
sitting,
Yeah.
ground-based stuff, you know.
Yep.
But we won't load
Legs
you on
up
like
or
carries.
something.
What's that?
Yeah, legs up or something.
Exactly.
like that.
Legs up. Exactly.
Yeah.
And then what you can do afterwards is come and hit that Normatec, and that'll be another way we can kind of push some of that fluid out.
Okay.
So we'll kind of get you on the Normatec and do another kind of session with that. Okay, cool. All right, so we took him through some lymphatic drainage. We incorporated some a recovery setting on the Compex to create that fast twitch response. Again, goal being to aid in this resolution. His body knows what to do. So the next step in this process, and what we're going to do to finish this, is we're going to use some RockTape to lift the skin. We're going to use that biomechanical lifting effect of the tape to lift the skin to allow a little bit less congestion of those lymphatic vessels. So to prep for this, I'm just gonna spray. This is rubbing alcohol in a bottle. I'm just gonna spray it on the treatment towel that I just used for him. We're just gonna clean off his foot and ankle really well, because we don't want any lotions or oils on this. Otherwise, the tape's not gonna stick that well. So I'm gonna show you guys a kind of a combo, like support strapping, taping, as well as kind of this lymphatic drainage. So I'm gonna take the lazy way out and use the pre-cut lymphatic or edema strips that RockTape sells. You can certainly cut your own, but I'm gonna be lazy because I have them and it's gonna look really good.
Pre-cut, Mike.
Pre-cut, dude.
I'm so disappointed.
Hey, work smarter, not harder. You know?
All right.
That's so funny. All right, so let's go grab some of that. Okay. This is what we're working with here. These are the pre-cut edema strips. So you just, right out of the pack, they're cut and ready to go. So open this up. I grab 2 of them. Look at the 20 coming in a pack. Oh, see, so easy, right? So this is a 4-inch wide piece of tape cut into 5s. Beautiful. Super lazy. Contrary to popular belief, you do not have to anchor these towards the heart. So what I'm going to do is anchor them at his foot and have the fingers go up so when he slides his socks on, he doesn't peel all of this tape off. So I'm going to start one on this medial aspect here. So I'm going to lay that anchor kind of right there. And then I'm going to take the other side. So what I'm doing here is I'm just cracking these fingers off one at a time so that I can just peel this backing off and leave the paper on the fingers, okay? And then this one's going to go on the lateral side of his foot. Right, and so basically what I'm going to do is kind of weave these one at a time. I like to start with the middle one because it kind of gets, and so for this thing, I'm not going to stretch his ankle, so I'm just going to opt to put a little bit of tension on the tape here as we spiral this up his leg. So I grab this one here. Right, so I'm getting right over that sinus tarsi. So I'm opting to put a little bit of stretch on the tape, not a ton, but I want to create that rebounding effect, right? So I'll peel that backing off, tension it a little bit. I'm going to leave some space in between each of these strips too. And the reason we do this is just to create more surface area, cover more skin with less tape. Just like that. All right, we'll go here now. And I'll flash a graphic of what the lifting effect looks like on the skin. But you can see we kind of got this badass looking weave going on. And you don't have to do it like this. You can do this any number of different ways. This is just kind of how I prefer to do it. Kind of helps the tape lock on itself. Do 2 at once. Don't try this at home. Just kind of let them go where they want to go. Okay. So the last thing we're going to do here, and that's just to kind of help resolve some of the swelling. The last thing I'm going to do is just put one piece, like a stirrup, to give him some medial and lateral support. So I'm just going to cut a solid piece, right? Solid piece about, I don't know, like 18 inches, 20 inches long. We'll round the edges here. I'm going to cut it in the middle. Expose that middle of the tape. So just, Thomas, actively flex up like that. Good. So what I'm going to do here is I'm just going to lay this on his heel, right? So I'm anchoring it on the heel. And I'm actually going to pull some more tension on this outside part of his ankle. And this, again, is this going to stabilize his ankle for him? No. Is it going to feel more safe and more secure and give him some pain mitigation right here via a sensory input? Yes. So that's kind of the goal with this, is just to help it feel a little bit better, feel a little safer, a little bit more supported. On the inside part, I'm just going to lay this up. Just like that. All right, there you have it. So welcome back to the underground. This is a quick 30-minute treatment session on an acute ankle sprain and how we might want to manage these early stages of the healing process. I want to say a quick thank you to Tom for letting us take this video today, and hopefully you guys will be seeing more session sitting videos on YouTube coming up shortly. This was a good opportunity for one today, so we'll get on getting those back to you. So if you want to see more, go ahead and follow us on Instagram at The Movement Underground. You can follow me on Instagram at MikeStella_ATC, and visit us online at themovementunderground.com. Until next time, thank you guys so much, and we'll see you later.